Recently, we took the difficult decision to substantially restrict visiting at the Rotunda due to the ongoing COVID-19 pandemic. We have requested that the public do not visit the Rotunda at this time.
We have cancelled elective gynaecology procedures and appointments, and we have restricted all visiting, including partners, at all outpatient appointments, all inpatient wards and the NICU.
These restrictions are strict and they will cause inconvenience and they will cause stress. We have received messages from expectant mothers and families worried about attending appointments alone, worried about looking after their newborn on the ward without the help of their partner. We want you to know that we did not make this decision lightly. These restrictions and any further restrictions are put in place in order to protect our mothers, babies, staff and the general public.
We care for almost 10,000 women every year. We know the role supportive partners and family members play in their care, their recovery and their health and their baby's health. We also know the unprecedented and exceptional risk that COVID-19 poses to our patients and their loved ones. As this crisis continues, we hope to work with our Rotunda families to put in place measures that help to alleviate the inconvenience and stress. But first, we wanted to share our reasoning for these restrictions and why they are necessary.
The Rotunda is in a unique position during this crisis. As the busiest maternity hospital in the country, we are open 24/7 and will continue to care for the hundreds of pregnant women during the pandemic. Women will still need to come into us for their antenatal appointments, for giving birth and for emergencies. This means that the Rotunda needs to ensure that we have a safe environment in order to continue to provide healthcare to women and their families.
We need to retain a high level of staffing so that we can continue to care for women during the weeks and months ahead. If a significant percentage of our staff are absent because of COVID-19 infection, this could have a detrimental effect on the care that our patients need. This is why we have taken these measures to drastically reduce footfall in the hospital during this time. We need to do it now so that we are prepared for the future.
The Rotunda is also home to the most vulnerable population of patients in the country. Babies who are born prematurely, who receive around-the-clock care in our neonatal intensive care unit. COVID-19 poses a very serious risk to these patients whose lungs and immune systems may not be developed enough to fight off this disease.
We also have additional challenge as we have one of the oldest healthcare infrastructures in the country with extremely constrained spatial restrictions. This makes isolation and distancing extremely difficult with our current footfall. This is why we have taken the decision to bring our visiting restrictions to the maximum possible level.
We know that pregnancy and birth, while it is a joyous time, can also be stressful, anxious and difficult. And going through key moments without your support may only make it more difficult. We want you to know that we are here, that you will get the best care, that we will support you as much as we can, and we will get through this together. So we're calling on the Rotunda community, mothers, fathers, families, to work with us in this difficult time.
To keep our staff,
our mothers,
and our babies safe.